So you've been diagnosed with congestive heart failure, or CHF. Here's what you need to know and a bit of what you might like to know. So heart failure means that your heart is weakened and it isn't pumping as well as it should be. Because the heart isn't pumping fast enough, the blood is essentially waiting in a queue to get through your heart. So it can either wait in the lungs to get through, or it can wait in your legs. Now, if it waits in the lungs, it's like having fluid in your lungs, and you can imagine it's very hard to breathe when you have fluid in your lungs. So you become very short of breath. If it waits in your legs, then it will cause your legs to become quite swollen. So these are signs that you're having worsening of your heart failure. In the emergency room, we treat these with a powerful diuretic or a water pill called Lasix or furosemide. And we get rid of that excess fluid so that you can breathe again and your legs become a bit less swollen. You may have been prescribed some of this medication, Lasix or furosemide, to take once you leave the emergency room. You should make sure that you take these and that you should follow up with your family doctor to adjust the dosage as necessary. That's very important. Now, while the Lasix treats the acute problem, it actually doesn't fix your heart in the long term. There are other very powerful medications that can actually rebuild your heart over time. And you need to be vigilant that you are taking these over the long term so that you can improve your heart function. These medications often end in pril, like fosinapril, or ramipril, or sartan, like irbesartan. There are some other medications too, but you need to make sure that you take them and speak to your family doctor about those. Something else you can do is make sure that you limit your salt intake. Don't eat too much salt because that will make you retain fluid, and that makes your heart have to pump harder to deal with that extra fluid. Something else that you can do is actually take your weight every day at the same time. Write it down, and then when you see when your weight is going up suddenly, that means that you're retaining fluid, and you should see your family doctor about that as soon as possible. That way you can get on top of the heart failure in advance, and you don't end up in the emergency room seeing me once things have become very bad. Again, very important to follow up with your family doctor, even if you're feeling a lot better after you've come out of the emergency room. This is a complex disease, and studies have shown that you'll do better if you see your family doctor afterward. Reasons to return to the emergency room include chest pain or tightness, particularly if it's worse when you're walking, a new fever, so that would be 38.0 if you're working in Celsius, or 100.4 if you're working in Fahrenheit. If you have one leg that is swollen but the other leg is not, that's a reason to return to the emergency room. And lastly, if your shortness of breath is getting worse, such that you can't even speak a full sentence when you're sitting down, you should absolutely come back to the emergency room for that. I'm Dr. Atsema, and those are my discharge instructions for congestive heart failure.